Welcome to the Lyster Health Talks podcast. Listen in as the team focuses on relevant, relatable health content that empowers your health and the readiness of the force. We are officially clearing the runway for a special mini-series dedicated entirely to aviation medicine. Over the next few episodes, we're diving into the critical role aviation medicine plays in keeping our pilots and crews mission ready and showing you exactly how our care keeps you in the air. Let's prep for takeoff as we talk aviation medicine here at Fort Rucker, the home of Army Aviation.
Welcome to the Aviation Medicine mini-series from Lyster Health Talks. I'm Lieutenant Colonel Leah Steder, the Director and Commander of Lyster Army Health Clinic and the host of the Lyster Health Talks podcast. One of the most common questions we hear at Lyster is, why isn't my flight physical done yet? Many aviators assume the delay happened at the clinic, but the reality is that flight physicals involve multiple steps, multiple reviews, and sometimes factors completely outside our control. Today, I'm lucky enough to be joined again by Major Pettinari and Liz Johnson-Bailey.
Hi.
Again. Thanks for having us again.
So today we're going to discuss some of the most common delays of flight physicals and why they happen. So Liz, for someone getting their first flight physical, can you walk us through the process from start to finish?
Okay, you're going to call 1-800-261-7193 to book a Part 1, only if you're at Fort Rucker, because we're not going to book you if you're not at Fort Rucker. You will be booked for a Part 1 exam where you'll see our physical exam staff. You'll complete a 2807-1 and a 2808. You will then go through a vision screening, a hearing exam. Any appropriate lab work will be ordered. You will complete your online portion of your periodic health assessment, and you will be booked a Part 2 with a provider. Then you'll come in for an appointment with your Part 2 and see your provider. If you are a go with everything and you have no additional information, your information is electronically submitted to the Army Aeromedical Authority. And depending on the type of physical, if you are a rated aviator, you get an upslip. If you're a student, you may get an upslip depending on if you've applied and you're going to school. If you're an applicant, you will not get an upslip. AMA will review your physical and determine if it's qualified or disqualified. So things that can delay that process. If you go to the Part 2 and you need further workup. If you have omitted something from your history that is found during your electronic health review, and we need to refer you off post. If you were seen sometime during the year and you were referred for an evaluation that you never completed it, if you didn't complete your lab work, if your lab work was abnormal, or if AMA reviewed your physical because your flight surgeon said it was qualified and we have found some additional information and need additional information from your flight surgeon, we can return it as disqualified, incomplete, waiting on information from that flight surgeon.
I would say from a mental health standpoint, if a flight surgeon refers you to behavioral health, and this is an initial evaluation, one of the things that we will look at is obtaining any off-post records. And so one of the holdups in mental health is if it takes a long time to get those off-post records, we will not book here at Lyster until we have those records, which could contribute to the delay time.
That also holds true for off-post records for consultation notes too.
Now, thank you for all of that. And you've mentioned AMA several times, but many aviators probably still think their flight physical is complete once they walk out the door.
Unfortunately, no. It has to go through a review process.
How do specialty consults sometimes affect the length of a flight physical?
So it really depends on the specialty itself. If it's a commonly sought after specialty that we have a lot of local availability, a few things that you can do to help those records get sooner is, one, once the visit's complete, ask, when can I pick up records to bring to my flight surgeon? You can submit those through your electronic health record to your flight surgeon to review, and then they become part of your record. It does take a delay. Humana has 30 business days to get those records to us, and they are only required to send the first visit on a consultation. So if you've seen a specialist multiple times, it is much easier for you as the patient to get the record to bring it to us than for us to wait for every time we get a records request. On certain specialty evaluations where there are not local providers that you're maybe traveling to Birmingham or Atlanta or Florida Panhandle, they're not as local as Enterprise proper. I would recommend also getting those notes and bringing them back. There are some people who will be sent to another military treatment facility. Those notes we tend to have immediate access to as soon as they're written. So they're not as hard to obtain.
I would say it's almost imperative for the soldier to get those notes as quickly as possible, because that's where I see is the biggest delay, is the time it takes to get those off-post records.
And not just
we'll get the appointment and then get the record so that we can get it uploaded into the chart and available for the flight surgeon and ALMA.
And sometimes not just notes, but also results of diagnostic testing such as MRIs, lab tests, or any specialty screenings done in those offices.
What medical documentation do most aviators forget to bring to their appointment?
All of it.
Their eyeglasses. So if I had $100 for every time it's in their car, I was like, well, that's great. I hope that car is here today. Did you not just come out of that car?
Are waivers typically the biggest cause of the delay?
I would say yes, because if your physical doesn't require a waiver, nothing stops me from submitting it, within a day or two after you leave, if not that same day. The waivers are the things that are more time consuming, because if you think about it, it's kind of a mini medical board on why you should stay in the aviation field. I have to justify what is your job, how are you important to aviation, and why this condition. Even though you have this condition, it's not risky for us to keep you flying.
Perfect. Talk a little bit about some of the myths and misconceptions. Now, we've talked about it in a previous episode, but true or false? If I do not require any waivers, my flight physical will be approved immediately.
False. It still has to go through ALMA. So your flight surgeon will complete the evaluation, upload the aeromedical summary to Aero, and then it goes to ALMA for review.
True or false? If I wait until the last minute, the clinic can always get me done before I expire.
False.
Absolutely false.
But
And
if you are still within your birth month, you can come in for a one-time 30-day birth month extension in which you have to complete your physical before the last day of the next month. So that means if your birth month is February, you have to come in before the last day of February to do that. You cannot come in a March 1st if you have a February birth month to ask for an extension.
True or false, one of the biggest delays is personnel not scheduling their appointments if they were referred for a consult.
True.
We've mentioned waivers several times, but what can patients do to help expedite waivers?
They can ask their flight surgeon what the waiver is for, what condition is disqualifying, and what are the requirements for the waiver. We can give them a copy of the aeromedical policy letter. Now, sometimes that can be a catch-22 because I've had patients go, well, this doesn't say that exactly. And I promise that I am the aeromedical expert on this, and I can tell you exactly what's required and what's not required. You can, by all means, ask me, so what does this mean? And I will write out, you need this test, you need this consultation, you need these results. And at that point, once all of this list is done, we will request your waiver. I think it's very difficult as a patient to be like, wait, what do I do? Do I sit here and wait for something to come in the mail? When as a provider, I can give you a checklist. And, aviation people love these checklists. You have a checklist to start your aircraft. You have a checklist to work a tower. Ask your flight surgeon, what is the checklist to manage my condition and how to get this waiver?
Now, as we wrap up today's episode, done probably 30 or 40,000 flight physicals possibly, or looked at in your career?
I've done 16,000, but I've qualified about 28,000.
That's awesome. What's the fastest flight physical you've ever completed?
Oh, like
or seen completed all the way through the process?
Like from seeing the patient to being qualified, probably about 22 minutes.
That's awesome.
I mean, when AMA was on the other side waiting for the physical.
That is a very rare case, however.
It doesn't happen anymore. Like perfect patient, no history. It still can happen very quickly. I mean, we've had some that get approved the very next day. It just kind of depends on what's in the mix and what's going in. Now, realize that at AMA, we process about 3,200 physicals a month and about 600 waivers.
Excellent. Do either of you have any firsthand experience going through flight physicals, and what is a delay that might interest some of our listeners?
So this is going to date me. Back when Top Gun came out, I was a medic in the Army, and I said, you know what, I could probably fly aircraft. And I went, and I lived in Florida, and I went to the Navy, and I did a flight physical. And they did flight physicals on Thursdays, just like we do, which was kind of funny. So I checked in. I was starving, and I had my blood drawn. And the first thing you do in a Navy physical is you go and you do your vision. And I have 20/15 vision, and I'm like, I'm going to nail this. And I go in, and I have 20/15 vision. And the next thing is the little slide box where they check your depth perception. And that's the little circle test for people who don't know what depth perception is. And so the corpsman says, which circle is closer to you? Well, I'm a concrete thinker. And I'm like, this is an idiot test. All of the circles are on the same card that you slid in front of me. And I'm like, none of them are closer to me. They're all on the same card. He's like, no, one of the circles is closer. Tell me which circle is closer. And I'm like, I don't know. He's like, well, if you don't know, then guess. So I said, right. He goes, wrong. Puts another card in there. He goes, which circle's closer to you? And I said, left. He goes, wrong. Take your packet and go to the front desk and sign out. And I'm like, but you have my blood. Well, in the Navy, they don't give waivers like we do in the Army. In the Army, if you had failed depth perception, you would have had like 3 other tests. And then you would have seen the eye doctor, and the eye doctor would have said, hey, you can have a waiver for that. Well, of course, I don't know this till 10 years later when I'm an Army flight surgeon student, and I go, I could have gotten a waiver for that. What really was the option is the corpsman didn't give me the right instructions for the test. He was supposed to say, glance quickly across the row of circles and tell me which circle appears differently. So I think the lesson to take back from this is to communicate with the person who's either given you instructions if you don't understand, or your flight surgeon. Communication and transparency are key. I guess it's probably good that I wasn't a Navy pilot because I kind of suck at flying. I figured that out after going to the flight surgeon course. I'm not really meant to be a pilot.
In the simulators?
In the simulators, yeah, it was terrible. There's a colonel on post that I flew with who told me that I gave her motion sickness, and she doesn't get motion sick. But anyway, I'm a much better flight surgeon than I am a pilot.
Well, I think probably
And I have a couple of waivers myself, but the Army was easy about getting waivers.
Well, I would assume the aviation community is very grateful because at this point you've probably done the flight physicals of half of the force.
Maybe. I've done grandchildren of pilots flight physicals, so, and children of pilots flight physicals that I know.
As we wrap up today for each of you, what is one thing you would like our listeners to take away from this episode for preventing delays to their flight physical?
I'm going to say transparency and partnership, like I said the last time.
I'll change up mine a little bit and say ensure that you are diligently working to get records from off-post entities so that your flight surgeons can process your physical.
Thank you. And they've heard this in other episodes, but remember your birth month and book early. Thank you both for joining us again today.
And that wraps up another episode of our Aviation Medicine mini-series on Lyster Health Talks. Stay healthy, Fort Rocker.